Thank you for choosing Middlesex Hospital for your surgical procedure. This video is intended to give you a brief overview of what you can expect on the day of your surgery. When driving to the hospital, please remember that Crescent Street is a one-way street, so you will need to access Crescent Street from South Main Street. When you arrive, you will see that Middlesex offers free convenient parking in the main patient and visitor lot adjacent to the main entrance. If a patient has difficulty walking, they can be dropped off in the designated drop-off area. Once in the main lobby of the hospital, you will see one of our patient greeters at the front information desk who can help direct you. The elevators you will need to take are located to the right off the lobby. You will need to go down one floor to the ground floor level. Once you arrive in the surgical services area, you will need to visit one of our patient registration representatives or check in with one of our volunteers. If the registration representatives are all serving other patients and there is no volunteer available, simply sign in and someone will call you when it's your turn to be registered. Once you've completed the brief registration process, you can have a seat in one of the comfortable waiting areas until one of our clinical staff members comes to get you. When the nurse or patient care technician comes to get you, they will bring you to the pre-operative area. The pre-operative area is called Pod A. In this area, we will bring you to a room so you can change into a patient gown in preparation for your surgery. Once you are settled in, an IV will be started. At this point, you may have a visitor join you until we take you to the operating room. While in Pod A, you will meet your surgery team, including nurses, your surgeon, and your anesthesiologist. Your surgeon will mark the site of your surgery and ask you a number of questions. These questions may seem repetitive, but we ask them to ensure we are providing the safest care possible for our patients. When your operating room is ready, someone from your surgical team will come to get you. Most of our patients will be brought to the operating room on a stretcher. However, patients undergoing weight loss surgery are generally required to walk. Once you are resting comfortably in the operating room, the nurses and your anesthesiologist will connect you to a number of monitors. And when the anesthesia medicine has taken effect, your surgery will begin. During your surgery, your family member or friend can track your progress. Each patient has a unique number assigned to them, so a quick look at our surgical tracking monitor will tell your visitors where you are and if everything is on time while still maintaining complete confidentiality. If you are having a surgery that requires you to stay at Middlesex Hospital for 1 or more days, you will wake up in the PACU or post-anesthesia care unit. The specially trained nurses in the PACU monitor your vital signs as the anesthesia medicine wears off and you begin to wake up. There is a special phone in the waiting area that we will call to talk with your visitors to let them know how you are doing. Once you are awake and have stable vital signs, you will be transferred up to a room in the hospital in one of our post-surgical units. When you get to your room, you may have visitors. We do not generally allow visitors in the PACU. Once you have recovered enough from your surgery, you will be discharged from the hospital. If you are having outpatient surgery, you will wake up in the outpatient recovery area. Again, specially trained nurses will be monitoring your vital signs to ensure your safety. When the anesthesia medicine has worn off enough and your vital signs are stable, you can have a visitor. Once the nurses have determined that you are ready to go home, they will get you ready to leave the hospital. For safety reasons, we require all patients to leave the hospital in a wheelchair. This completes your virtual video tour of the surgical services experience. Again, we thank you for choosing Middlesex Hospital.